Today I'm going to show you how to start an IV. Now I'm not going to use an actual person because some blood makes people queasy. So I'm going to demonstrate on a piece of IV tubing. We actually use IV tubing as a training tool if we don't have an arm available. So let's get started. First, I need my supplies. I have a tourniquet, my arm, or today I have a piece of IV tubing taped to a bottle, alcohol to clean the site, my needle, the HEP lock which inserts into the end of the needle. That way you can still have IV access, but you don't have to be running IV fluid at the time. Keeps the site intact and clean. And once that's all done, we tape it down, so I have tape, and then we put on this, which comes off to a clear piece of plastic that sticks to your arm, and it keeps the site clean because you now have a hole in your arm. This keeps bacteria out of it. Let's get started. First, I'm going to show how to apply a tourniquet. I'm going to use a bottle because I don't have an arm. You wrap it around and you just make a bow. You pull really tight. And make a bow. Once this is done, you're going to search for a good vein, so you're going to ask your patient to make a fist and squeeze. Since the tourniquet's up here, there's no more blood flow coming down the arm. So if you squeeze, it pumps all this blood up and makes the vein pop. Once the vein pops, you have a good view of what you're going to be sticking. So right now, like I said, I taped a piece of IV tubing to a bottle. I'm going to show you how to start an IV. First, you're going to look for your vein, which I have a good one right here. Once you find that, you're going to take your alcohol pad and you're going to clean it. You can move it in a circle up and down, just a nice area of what you're cleaning. Clean it all the way. Okay. Then you're going to take out your IV. This is what your catheter, IV needle catheter looks like. This is a long one, but they're all about the same. They come in short, where this right here is a little shorter, but this is longer. This is a 20 gauge. I know this is a 20 gauge because the catheter hub is pink. You can tell the gauge of the needle by what this color is. This is a 20 gauge needle, which is mostly used. You have this pink part is what stays in your arm. This right here is a clear piece of plastic. It's like a straw. So you stick with the needle and you pull the needle out, and this is what's actually stayed in your arm. Just put that back. You can see this is the bevel. It's a slight angle to the needle. You're going to stick bevel up, so the point end goes towards the skin. That's how you stick. You'll know you're in the vein because this part right here is called the flash chamber. So when you get in your vein, you'll see a flash of blood. Some blood will go in there. Okay? And then you stick, and then this right here is a white button that retracts the needle into this chamber right here. So it's a safety. It's a safety. That way you don't stick yourself once you pull the needle out. So once you stick and you're in where you want to go, you hit that white button and the needle retracts. So let's get started. Okay. And you only leave the tourniquet on the patient's arm for about 2 minutes. Because you can take longer than 2 minutes searching for your vein. So pop the tourniquet off, let the arm relax, and reapply it and have them pump their fist again to get that vein to pop back up. Okay. So I'm going to clean my site. I'm going to take my needle, bevel up. I'm going to pull the skin above where I'm sticking tight. That way, because sometimes if you don't, when you stick, the skin will move and you miss your vein. So I'm going to pull it tight, find where I want to go, and stick at a 45-degree angle. I'm going to go in. Okay. Once I'm in, I'll see a flash of blood in this chamber. When I see that, I still want to advance, but I don't want to keep going at a 45-degree angle because I'll puncture through the other side of the vein wall. I just blew that vein, and you'll have to start all over again on another vein. So once I'm in and I see the flash chamber, I'm going to lower my needle towards the skin of the patient, and I'm going to advance it forward a little bit. That ensures me that I'm inside the vein. Once I'm in that, I'm going to take my thumb above where the needle is on top of the skin and hold pressure. That closes off the vein. Then I'm going to retract my needle. That keeps the straw in there. Okay. But before you do that, you want to make sure that this pink part is touching the patient's skin. Okay, once I retract the needle, I'm going to get my hep lock, which is right here, and it's just a screw end because the hub is now open. So take your little screw end, and as soon as you put that in there, you can let go because now blood's not going to flow through. You're just going to screw it in. Okay, now I'm going to take some tape. I'm going to tape this to the patient's arm. You'll actually use a little bit bigger piece than this. Tape it to the patient's arm. That way it doesn't go anywhere. It helps stabilize it. You can use as much tape as you need to. Then I'm going to take this and peel it. This part right here is really sticky. This is what goes to the patient's skin. So I'm going to put it down. Get a good stick. Then we're going to peel. And it's going to leave a clear plastic on the patient's arm, and this is going to help keep stuff out of the IV, because it's clear so you can still see what's going on in there, but nothing's going to get in unless you take it out. And this hep lock is that way you can unhook IV fluids and stuff, and you still have IV access. But also, patients get meds, they get medication through syringes, and the syringe looks just like a little screw in on, and you just screw it in and you can push it in, and that's how patients get their medication and their IV fluid. But this is how you get an IV. Pretty simple, and every day is great for someone to learn how to give an IV. They're teaching basic trainees in basic now on how to give this, because if you know how to give an IV, you help a medic in combat and you can save another person's life.